Remember my last YouTube short and this 91-year-old gentleman with an in situ melanoma on his shoulder? What are the odds of him having another one at the same time on his neck? Here's the demonstrable. What do you think? To the naked eye, it's irregular, but smooth and flat to touch, and smaller than the other proven in situ melanoma. The dermoscopy is less scary, if that's a proper dermoscopy term. There's a nice pigment network pattern, meaning this is of melanocytic origin. Remember, the dark lines are melanin pigment on the downward projections to rete ridges. The holes correspond to the flat tops of the upward papillae. Did you think the network pattern was atypical? I always think it's a bit like how long is a piece of string. It's a continuum with maybe normal-looking lines and network here, but thicker, darker lines over there. Let's call it a definite maybe. What about these pigment dots? They appear to be located in the holes of the network and are melanin in the dermal papillae upward projections. There are three possible causes for this appearance. Firstly, nests of melanocytes. I see this most often in congenital nevi. Secondly, melanin within keratinocytes in lentiginous lesions. And finally, melanoma pigment dropping out in a melanoma or regression. But these tend to be more variable in colour and size. It's slightly asymmetric, which is a concern with this darker patch here in the centre. And if you thought there was a little bit of blue-white veil over it on polarised light in the video, then well spotted. I didn't think, however, there was any convincing regression structures. We mentioned this second lesion in our cancer care pathway referral. It was also excised. Here's the histology. The summary was, overall, this is best regarded as an atypical, lentiginous, junctional melanocytic nevus, that's a mouthful, with focal evolution to in situ malignant melanoma of a malignant subtype. What's the odds of a patient presented with two melanomas at the same time? It happens to be around 1 in 100 patients. If you find one melanoma, go hunting for its partner in crime.